Hello and welcome to another episode of the Health Notebook. Today we have a very special guest in the studio, Mr. Don Ruffels. Mr. Don Ruffels was diagnosed with a particular lung cancer, and he's here today to discuss his personal opinions, views, his thoughts about the illness as well. Mr. Don Ruffels, welcome to the show.
Yes, thank you very much.
Mr. Don Ruffels, can you just tell us a little bit about yourself?
Yes, I'm 76 years old and I'm married for a long time, and I've worked in the workplace for many, many years, and I'm still going.
And you're still going. Okay, so I know you've worked before in the shipping industry, and then 4 years ago you were diagnosed with a particular lung cancer. Can you just share your initial views about that diagnosis in terms of that particular lung cancer that you were diagnosed 4 years ago?
That particular lung cancer really hit home because it's not a type of lung cancer that I have. It was asbestosis. Going over to what they call a rare form of cancer, which is mesothelioma. And I was very, very taken aback and lost a lot of weight with it.
Okay. So besides the loss of weight, what other symptoms did you have before they actually diagnosed you with this particular lung cancer?
A slight bit of depression, and then I just had to think about it positively, and so I carried on positively with it, taking whatever medication they're giving it to me, and I even became more positive on that.
Okay, Mr. Ruffels, let's go back 4 years ago at the initial diagnosis. Just run through the entire process just to make the viewers aware of the process that you followed during this time period.
4 years ago, I was finding it very difficult to breathe as I was getting into bed, and I wondered what was wrong with me. So I decided to go to for medical help, and they said that my lung was filled with water.
Okay.
And I needed to have it drained. Okay. So I went into hospital, and they took a sample, and when the sample came back, they said I have a rare form of cancer or asbestosis that turned into mesothelioma.
Okay, so I'm just going to explain to the viewers. Asbestos it was present in certain working environments before. So in your particular case, I know it was within your work environment that you may have contracted asbestos, and most people, they don't understand what is asbestos. So just to inform the viewers, asbestos is a small type of fiber. It's normally mined and it's used in different products. It was previously used in ceilings. It was previously used in heaters as well. But during those years, people were not aware of the health risk associated with this particular fiber. So asbestos was a fiber, and what would happen is that if it was within your work environment, and if you inhaled it, it actually went to go sit in your lung. And the whole idea of asbestos, just to inform the viewers, is that it can remain in your lung for a very long period of time. And in your particular case, I mean, that's yeah. Basically in your particular case, that this fiber remain in your lung, and 30-40 years down the line, you've developed the illness. Okay, so you've been through to the medical doctor. They then confirmed it with this particular type of biopsy that they've done. What happened next?
The next thing is that I was referred to an oncologist, and the oncologist took a CT scan, and he said, yes, I have this mesothelioma, and there are 2 or 3 nodes above my lung. That's not the inside of the lung, that's out of the wall of the lung. And he said I need to go and have chemotherapy.
Okay, so what they actually confirmed is that you have a rare type of lung disease known as mesothelioma, and asbestos was the likely cause of this particular type of cancer. Asbestos can also cause other types of lung illnesses, which would be then the asbestosis. It can also be the fluid that you've mentioned. So this one particular fiber can actually lead to a number of illnesses within the lung. Okay. So you've also mentioned that you've been for chemotherapy. Just run us through your initial thoughts before starting chemotherapy. There is this vague, or there is the common perception that all chemotherapies lead to severe side effects. What were your thoughts before starting chemotherapy?
When the oncologist said to me that I needed to have chemotherapy, I was very nervous about that. But I had my family that was around me, and especially my daughter, and she said to the oncologist, if it was you, what would you do? He said he'd have chemo. So then I said, okay, I'll have this chemo. But it's not the regular type chemo for people that have cancer of the internal part of their lungs or anywhere else. It's a different type of chemo called Alimta and Cabo.
Okay, so you received a very new type of therapy, and when you were actually going through this therapy, what were the side effects, or what were the side effects that you experienced with this particular type of chemotherapy?
Initial chemotherapy, the environment was good, and the side effects after the chemo was that the first day was nothing. The second day I lost my taste, and then 3 to 5 days later I was down in a low, if one could call it. But after 5 days I was coming out of this.
Okay. And this is just to highlight to the viewers that chemotherapy, each person's individual experience is different. So in your case, you were able to recover within a short period of time after the chemotherapy. And did your taste come back as well after the chemotherapy?
Yes, no, my taste started coming back after the 5th and the 6th days. So I was turning to normal again.
Okay, and just to also enlighten the viewers, with Mr. Ruffels' diagnosis, there's normally a prognosis of about 2 to 3 years, but with his particular therapy, he is now, it's been 4 years ago that he's been diagnosed with this particular illness, and he's been receiving his chemotherapy. Can you just tell me, how has that affected your quality of life? Are you still able to continue with your daily activities? Or just tell me a little bit more about your social environment and your normal day-to-day life.
No, it didn't affect my social life and my life very much, because I had the support of all my children. I have 4 children, and the nearest one is my daughter, and she always had her thumb in my back and made me be very positive.
Okay, so there was the social support structure that you had while receiving this therapy.
Very important that the family social support be there all the time, and not in a worrying state, in a concerned state that I do what that has to be done.
Okay, so we have the family that provided support. What about your day-to-day activities? What else are you involved in?
My day-to-day activities is that I am a pastor in religion,
okay,
and I have a very strong belief,
okay,
and that is also a support system. And through my pastorate, people were supporting me in prayer and in many other ways.
Okay, that's excellent, because also based upon your experience, you can also provide other individuals with a sort of guideline on how to deal with the situation. And have you come across individuals where you needed to take your personal experiences and transfer it across to other individuals and give them hope? Have you come across individuals?
Yes, certainly. Funny enough, when you are diagnosed with a form of cancer, you seem to meet many other people with cancer, and everyone thinks it's doom and gloom. But I've been trying to help people, saying, no, it's not doom and gloom only. Remain positive in your medication. Listen to what you have to take and do, and have a support system. prayer is one of them, and your doctor is very important, especially your oncologist. They are important people. They're there to help you get better.
Okay, so you've been continuing. Okay, I'm just going to take this back. Okay, so you've been living your life normally. Can you give the viewers some additional advice? I mean, or maybe just enlighten the viewers. Okay, so now you've taken your chemo. You've been through how many cycles, if I may ask?
I've been through 16 cycles of chemo for the first 2 years.
Okay.
The first 2 were 8, and then these nodes that I had on my top of my lung weren't going any bigger or any smaller, but he suggested I have another 8 sessions of chemo, which I undertook, and things were coming right, and I was very positive with that.
Okay.
My life was always the same. I never changed my life. Whatever I was doing it, and happy in doing it, as long as I knew that things were working out in the right direction.
Okay. So you have been taking your chemo, and then on a regular basis you have also been monitored in terms of having scans to make sure or to evaluate the progression of this particular cancer. Can you just tell us, did this even affect your eating habits or any other effects that this chemo had on you?
Chemo, I had the 8 sessions of chemo, and through that chemo, every 3 months I had to have a CT scan. And things seem to have been going all right on those CT scan viewing. And so it didn't affect me in my life as much. It's more positive, giving that the chemo was helping me.
Okay. You've also traveled overseas recently. I mean, this is just a remarkable person. He's been diagnosed with cancer, he's continuing to receive his chemo, and he's also been overseas. What were your thoughts before you left South Africa to go overseas, knowing that you have this medical condition, knowing that you're receiving treatment? What were your thoughts before you left South Africa and before you've been overseas for a month now?
My thoughts was, first of all, will I be able to take the flight?
Okay.
And yes, I was diagnosed, and my doctor said, yes, take the flight.
Okay. So just to also inform the viewers, if you do have a chronic medical condition and you need to go overseas, you need to be cleared by your medical practitioner as well. Okay, so you're on the flight now, and what are your thoughts now when you're going overseas?
Well, on the flight, it was a long flight. I went to the United Kingdom for 6 weeks, and I hadn't really a positive way. I quite enjoyed the flight. The changeover at the airports wasn't too bad, and my health seemed to be holding out very well.
Okay. So you've traveled, you've got your family support structure, you're a minister as well, and I know you've also been taking care of your wife as well, which is another remarkable aspect to who you are. Can you, if you are allowed, can you just enlighten the viewers as well what you do at home as well in terms of looking after your wife as well?
Looking after my wife, we've been married 56 years. She was 17 and I was 20 when we got married. But as she was had a disability on her lower legs, but as she got older, her mobility became less and less. So she is now in a wheelchair. And my job really is there to assist her in every way with her in her wheelchair. She is a positive person, very determined on being individual in her own life. So now with the immobility, it was just help her in and out of the car, help her in the house, even do some of the cooking if need be. That's what I was doing. We've been married, and it was for better, for worse. And that's why I stick by my wife, because it was a commitment.
Okay, that's excellent. Okay, Mr. Ruffels, what are your thoughts, or what is your final words just to give people hope out there and to give people hope in terms of those that have been recently diagnosed with cancer, or those that have been diagnosed with a chronic life-threatening condition, or even those that are receiving chemo. Can you just give them your thoughts, or a message of hope?
My message of hope, first of all, is take it day by day. That's what we got to do. And in this taking it by day is that you must be positive. I've said this over and over again. You have to be positive in your medication. And yes, cancer can have an effect on your life. It is life-threatening at stages. We do worry about our living. Of course, all of us have to sometime pass away, but if you're positive and know your oncologist, or do what your medical people are doing or telling you to do that, continue with that, and in your believe that what you do getting is helping you in the long run, and then you will remain positive in your life. Depression is one of the things that people suffer from when they hear they have these diseases, but in all diseases people can go down into depression. I say to you, lift yourself out of that and look forward to the next day. Live day by day.
Mr. Don Ruffels, thank you very much for those inspirational words. I think it will give a lot of the viewers hope and encouragement. It's been a great pleasure speaking to you. You are a remarkable person, and we will be continuing the discussion in terms of other types of cancers in later shows, but it's been a great pleasure having you on the show. Thank you very much.
It's been great to be here and great to be invited to speak to the people.
Thank you very much for viewing. Stay tuned for another episode next week, same time, same place.